All right, time now for our Health Watch, where we discuss all of the topics that are trending in the world of medicine and health. And as always, we're joined by Dr. Seyed Hussain from Trinity Health of New England, who's knowledgeable about so many different things. Good to see you again, Doctor.
Likewise, morning.
I know we have talked so much about COVID. And yes, we do want to talk about it again. By no means are we seeing any spikes like we saw 4 years ago, but we are seeing a rise, according to the CDC. Numbers in Connecticut low, but nationwide, 23.5% increase in emergency room visits for COVID. Going back 4 years ago, COVID being a respiratory virus, you'd assume it spikes in the winter, like the flu, like norovirus, like a lot of them do. And yet here we are seeing a rise in the summer. Does that just sort of speak to how different of a beast COVID is?
So, yes and no, Tim, because we've seen summer spikes even during the course of the pandemic, you may recall. That, and there are a couple of reasons for why this may be happening. One is we're seeing record travel, crowded airports, crowded train stations, but also because of the record temperatures we're experiencing almost nationwide, more people are staying indoors, which means larger gatherings indoors, and that's all a recipe for more transmission. As you mentioned, this is a respiratory virus. We all know what COVID-19 is and how it's transmitted, easily transmitted, and that's why we're seeing a spike. We've seen an increase in wastewater surveillance, and then the data point that you just mentioned, an increase in ED visits. Nothing to the tune what we've seen in the past, but definitely an increase in COVID-19 infections.
And it does seem like all this time, even though COVID doesn't appear to be nearly as serious as it was, it just seems to be getting more and more infectious and more easily transmittable.
It is. And to that point, what do viewers need to keep in mind? So it all depends on your individual risk profile. And by that, I mean, what is your medical status? Do you have any underlying medical conditions? Do you have anybody who you live with that is vulnerable? Do you have an elderly parent with a kidney transplant, for instance, or someone with multiple medical problems? If so, if the answer is yes, then there are some precautions that we are all aware of. Masking, for instance, in a crowded situation, making sure there's good ventilation, making sure you're up to date with vaccinations, making sure you have access to antiviral medications should you come down with a positive COVID-19 test. All those things to keep in mind. And don't forget rapid tests, especially prior to a gathering. Are all things that, are still tools in our arsenal.
Absolutely, and they will be there. Okay, on to the next topic. At the start of the month, it became legal for THC-infused drinks to be sold in licensed cannabis retailers and in liquor stores here in the state. And this is probably going to accelerate a trend we've been seeing for a while, people moving away from alcohol, especially in the summer months, and moving to other things like cannabis-infused seltzers. First of all, can we compare and contrast the two? Because they're not exactly the same thing.
They're not. So let's take a step back so viewers understand what we're talking about. So cannabis is, again, derived from a plant. There are over 100 compounds that can be derived, right? And THC and CBD are probably the two most famous, most common products that you'll see, especially in these drinks or edibles, for instance. THC can cause intoxication, euphoria, may alleviate some pain, nausea, and then CBD has more medicinal effects that may be utilized. But those are things that people need to keep in mind. Now, some of these drinks, again, disclaimer here, I'm not endorsing any of these drinks. I'm just giving some education for viewers because half of all Americans live in states where cannabis is now legal. So you will see some of these drinks pop up on shelves. It depends on state laws where they come up. But it may, and all of them vary in terms of their THC content. If you're somebody who's naive, never tried something before, lower is better. Also keep in mind, just like alcohol, that you should not operate machinery or drive when intoxicated. That's illegal.
And I think another big distinction here is that when you are drinking alcohol, you kind of know what you're getting, how your body's going to react to it, and the onset happens fairly quickly, a lot more quickly than it happens with THC.
Great point. Because people can sometimes think, hey, I'm not really feeling the euphoria or the effects that I'm supposed to, and they may consume more drinks, and then they might see to the other side of the spectrum, paranoia and tremors and things that you don't want to experience.
You need to give yourself more time to see how it affects you before you go reaching for a second one. And like you said, they vary, just like alcohol contents. If you look for 5 milligrams, a lot of them are dosed that way, but then you could easily be confused into taking some of the more medicinally derived ones, which are upwards of 50 milligrams, and you
That's
can get
right.
into a lot of trouble. You've got to read those labels and be safe, just
That's
like
right.
you would be with alcohol.
That's right, absolutely.
Doctor, again, I know you're not endorsing it either, but again,
You just have to make sure you're aware of what you're consuming.
Absolutely.
And the potential side effects and interactions with drugs and with alcohol. Do not mix both of them. So common sense things to keep in mind.
Yep, safety first. All right, Doctor,
That's right.
thank you so much.
Thank you.
Dr. Seyed Hussain from Trinity Health of New England. Guys, back to you.